Another question that is asked commonly is how to avoid or how to prevent the stomach cancer coming. Frankly speaking, I would say that it's a lot of depends upon the type of food we take. It is better that we take a good amount of green leaf vegetables and fruits. That should form a good amount of our daily food that we take. Second thing is avoid spicy and charred foods. The foods that are quite often charred for a long time and given, they have to be avoided. Once in a while it's okay, but it is not to be taken regularly. And processed food also be careful. Apart from that, if there is a symptom that is commonly seen, that is a gastric symptom, that you keep on belching, you have acidity, you keep on belching, and you take certain medications like antacids or PPI is what we call. Those PPI tends to reduce the acid levels in the stomach, and though they bring down the symptoms of this belching for some time, they also mask the real pathology, so which can go missed for a long time. So what I would suggest is, if any of you have these belching symptoms for a long time, that means to say more than 3 months or 4 months continuously, better go and see the doctor and take the advice. If it is necessary, go ahead and get an upper GI endoscopy done. That gives an idea about whether you have any reflux disease, acid reflux disease. That is, in the contents of the acids in the stomach going back into your esophagus. That can cause some changes in that area and can cause stomach cancer or esophageal cancer, lower esophageal cancer, or the commonly what we call G-junction cancers. It is a separate entity, but that is a similar pathology as that of the stomach. So never neglect the common symptom of acidity or gastritis. Second thing is that all of us, once in a while we do have that infection. H. pylori infection should be treated when suspected or when proved by endoscopy. But this is never to be neglected for long. This also indirectly predisposes to stomach cancers. Now, if any of the close relatives have had cancer of the stomach or the GI tract, we have to be little careful. Even in the younger age, we have to be little cautious and undergo the screening procedure in the form of upper GI endoscopy to look for any polyps, because some patients are into what we call genetically predisposed conditions. So these are very important, never to be neglected. Those are called the high risk groups, which if you have any patients in your relations who had cancer of the stomach, you have to be careful. Better to see the doctor who can do certain genetic tests and give you more clarity as to where do you stand as far as the risk is concerned. So basically, I would like to stress upon the fact that you should go with the food that is having more of fruits and vegetables and less of spice, and highly salted food to be avoided, processed food to be controlled or avoided as much as possible, and never to neglect the simple symptom that is gastritis or acidity, what we keep calling regularly.